right, everybody, welcome back. Have another great episode. We're talking pioneers, we're talking builders, we're talking Jacksonville, Florida. So we like to call it. It's PB and Jax for short. I have YaSheika Solomon with me, and she's with the Epilepsy Alliance. We're very excited to talk about epilepsy in all forms, also what the Alliance is doing moving forward. She does prefer to go by Yaya. So anybody that reaches out after this and says hello, please be sure to approach her in that manner. But for now, want to introduce her as YaSheika. So if you guys look her up on LinkedIn or Google, or you have an opportunity to find her, Yaya, thank you so much for being here.
Hi, Randall. Thank you so much for having me. I'm so excited to be here today.
I'm so excited that you're here. I've shared a little bit about why we're doing this and why I reached out to you. And I'm thrilled that we were able to put this together. I know you're doing a lot of great work with the Epilepsy Alliance, but I also know you're doing a lot of great work as chasing down your PhD and doing a lot of research. And I'm very excited to unpack that with you. So let's start with an intro. Let's start with you. Talk to me about who you are and what you've been doing the past few years and what led us here into the epilepsy conversation.
Okay, wow. So again, my name is YaSheika Solomon, and yeah, as you mentioned, yes, I'm in school getting my PhD in health psychology, and it's been quite the journey. A little background: I do have my undergrad is in health administration, health management, and then I have an MBA, and so now I've always been fascinated with the mind, and I'm really not a health nut, but I've done experiments on myself trying to maintain weight gain and like gluten-free and things like this. So I'm really interested in health psychology and some of the behaviors and mindsets that kind of coincide with how we take care of ourselves and what foods we're choosing and what habits we have when it comes to staying healthy. So throughout my process with that, I started working at Epilepsy Alliance last year, like of August of last year. Before that, I've worked in project management and environmental science, also like in surgery, so education, healthcare. So those have always been my passions, helping people.
All right. That's wonderful. Thank you. Out of curiosity, with all of those different interests that you've had, and especially in the medical field, what led you, whether that's heart or soul, into working with the Epilepsy Alliance and working with epilepsy in general?
So two things. Epilepsy Alliance, when I was wanting to make a shift into community work, Kaylee, who is amazing, she's my supervisor who I report to, she gave me a chance to work with this amazing organization. And a little backstory is my stepdad, he's no longer with us. He passed away years ago. He had epilepsy. So when I took this job, I did have that like in the back of my mind, wanted to kind of like break the stigma around it, because even though that was like many years ago, and I'm just going to say like for me and like the way I grew up, it was a stigma because my mom and my family, I never heard the word epilepsy per se. It was just like seizures, like he's having seizures. He's having seizures. And whenever that would happen, get the kids away. So we knew what was going on, but we didn't know what was going on fully. So when it resurfaced and I knew Epilepsy Alliance was out there, as I started researching organizations that I wanted to contribute to while getting my PhD and doing a community outreach, that kind of like stood out to me.
Okay, that makes sense. And obviously it was close to your heart, and it is to me too. And as you're aware, we'll get into that here in a little bit. So a couple of things. You got into the Epilepsy Alliance side and you were talking about stigma. Stigma is such a good word because I think it's all encompassing.
Yeah.
I, for reference, was incredibly ignorant about epilepsy and what it is.
Mhm.
I would see music videos where it was like, oh, okay, well, there's going to be flashing lights and strobing lights. If you have epilepsy, be forewarned. And then when I thought seizures, I was thinking people like violently shaking. And then I come to realize that's not necessarily the case when it comes to seizures. Can you, in broad strokes, paint a picture of what epilepsy is?
Yes, of course. So epilepsy is a brain disorder that causes seizures. So when I'm saying that, well, you go like, well, okay, what is a seizure? So a seizure is a strong burst of electrical activity in the brain. And if you think about it like a thunderstorm happening in your brain, that's like as you're doing something, it's going to affect your movement, your speech, your sensations. It's going to affect all awareness, anything that, all things, because your brain is like the mainframe, like, telling your body what to do. So it affects all of that. So I like to tell people to think of it like this way. Seizure is the event and epilepsy is a disease.
Okay.
And just because you have a seizure doesn't necessarily mean that you have epilepsy. Epilepsy has to be diagnosed by a neurologist or hepatologist. So say someone can have a seizure, from going from like alcohol withdrawal, drug withdrawal, or if they have like a reaction to like a medication or a food, they can have a seizure. It only becomes epilepsy when it is diagnosed. And that's usually like 2 seizures happening within a 24-hour span. And then, something that keeps happening or happens like every 3 months or 6 months or something. But it's usually consistent of those things.
Okay. Thank you.
No
If somebody's having a seizure,
problem.
or if somebody is witnessing somebody having a seizure, I already kind of touched on the fact that I think the shaking is synonymous, but what are some things that people who are having seizures and or somebody that is observing it, what are some signs, some warning signs, what it feels like, what it looks like? I mean, I just feel like there's so many different avenues that could be classified as epilepsy, and I'd like to make sure some people are experiencing something and they're not just brushing it off.
Okay. No, and thank you. You're bringing up some really good questions. So thank you again for, bringing this to the table and having this conversation.
Of course.
So just a little background. There's 2 types of seizures, and we usually like to put them in 2 groups. And one is called focal seizures, and the other one is called generalized. And focal just means that this type of seizure affects one part of the brain. So when we were talking about having a seizure and that is like electrical activity happening in the brain, if you're having a focal seizure, that's only going to affect one part of your brain, whether it's like the front, the back, the side, the corner. It's just going to be one part of the brain. And usually what that looks like in someone is like, say they were writing something or reading a book and all of a sudden they stop and they may just start blinking their eyes and like they're like frozen. And it can last up to 30 seconds. It can last up to a minute. They can be very brief and it can happen multiple times a day. And it impairs your awareness. Like I said, it can come with a blank stare or a repetitive movement. And I know sometimes when we think about a seizure, we think of the big seizure where you're falling down and you are shaking and, going through convulsions, but everyone doesn't have that type of seizure. And I'll give you a perfect example. I was doing clinic at an office here in Jacksonville last week. And when I was talking to one of the patients, they had a seizure, and I haven't seen someone have this type of seizure because, she just, 1 minute she was talking and then she was saying she wasn't feeling good and she got louder and then she started sweating. Then her arm kind of like went up in the air, kind of shaking. So a seizure looks different in each type of person. It doesn't look the same. So even though there are different types, it's not going to look the same in each person. And then you have the generalized seizure, which you were referring to, and that's the one that affects the whole brain. So this time, that's when the thunderstorm is affecting the whole brain. So of course, it's going to be a little more dramatic. The person probably will fall to the ground or fall out of their chair and they will start shaking, staring, have muscle spasms and things like that. So yes.
For people who are dealing with a focal seizure,
Mm-hmm.
if they're walking or riding and their concentration breaks, are they at risk of falling down too? Is it an involuntary thing where the brain shuts down?
So as someone, because the seizure looks different in everyone, that is a possibility that they may fall down. That's not always the case if you're having a focal aware seizure, because remember, it's affecting like one part of the brain. So usually it might just affect like how they're thinking or how they're moving. But it depends on what environment the person is in. It depends on where they are. Those things also you have to factor those things into as well.
Okay. On both sides, is there like levels to it, like a level 1 seizure, level 3 seizure, mild versus a massive? Is that on the same spectrum as, let's say, a stroke, where they kind of call things less severe versus more severe? Is there any kind of,
The,
lack of better words, we'll use spectrum?
yeah. So the terminology that's used in seizures is focal aware or impaired, meaning part or focal impaired. Generalized, that could be clonic, myoclonic. Those are the different names that are used for seizures. They're normally not categorized as level 1, 2, 3, or 4.
Okay. And then obviously an important question here on the non-focal ones, I assume that you can see visibly that somebody is having a seizure. And I know that you mentioned earlier, just because you have a seizure doesn't mean you have epilepsy, but at least there's a visible thing taking place where you're like, okay, this person needs help.
Yes.
On the focal front, let's say there's a parent out there and they have a 7-year-old kid and they see attention breaking, they can't read, they can't pay attention, maybe they're in discomfort. And with all the rising talk of ADD, ADHD, all these different attention deficit disorders, how, if you were a parent, how would you suggest that they go about if they see their child going through these attention breaks, what their next logical step may be, or maybe the fact that they might be identifying that their kid is dealing with epilepsy?
So that's a really good question. And I just want to point out that's super important for parents, but also whenever I do seizure first aid training, I definitely also make sure that I'm covering this with teachers and people in education that are teaching kids. Because there is a particular seizure, it's a focal impaired seizure where it happens like 1 to 30 seconds like you described. The student can just like start staring off in space and start blinking, and sometimes it can be mistaken for ADHD or the child having attention deficit or the child like daydreaming. And so my suggestion is when that happens, if it's a parent or if it's the educator or if you know a relative, if that's happening to a child that's in your care, I would start documenting it when it happens, how often it happens, and then I will just ask the child, depending on the age, are they remembering things? Like ask them questions, so things that they can remember. Because with this particular seizure, sometimes the child can lose like parts of their day. A seizure can cause that. Any kind of seizure can cause that, not just this one. But I would definitely document it, and then I will bring it up, when the child has an appointment with their physician. Because like I said, only it can be diagnosed by a neurologist or hepatologist.
Okay. And now we're going to go down the path that, let's say it was diagnosed. We know it exists. What are the treatment plans? What does it look? I'll ask this out of ignorance. Is it curable? Is it treatable? Is it normal life expectancy, lifespan? Is it short? And then what are the pathways to treat it, just in general sense, broad strokes?
Okay. So as of right now, there is no cure for epilepsy. However, there are different treatments out there. There's medications out there, of course, like pills that you can take. There is the VNS, that's like a vagus nerve stimulator that and that's a surgery. The brain stimulation, that's also a surgery. I know the keto diet, that's usually kind of recommended for children.
Interesting.
And depending on, their diet, or if like if they're going through other comorbidities, that's something that would have to be determined by their physician, of course. But that's something that's used to not cure epilepsy, but used to kind of like, as a medication for treatment.
What is the keto diet? That's so fascinating. What does the keto diet have to do with this? Like, what's the word I'm
What's the
looking for here?
correlation?
Yeah, the correlation.
So I know like people, so I've tried the keto diet before. In the keto, when you're doing a keto diet, you are just managing your micros and your macros. And what you're doing is you are eating a certain amount of fats, proteins, and limiting a lot of carbohydrates. So how, you're asking like, what does that have to do? How would that regulate epilepsy? And so it's just a chemical breakdown in the body. When you're doing the keto diet, it has been known to just reduce the effects of the seizure, of the frequency of the seizure. Yes.
That really is fascinating.
Yes.
The correlation with diet. Out of curiosity, let's say a parent isn't really picking up on the like what's taking place and it's going untreated.
Yes.
What's the significance of it going untreated? What's the importance of trying to get early diagnosis?
I would say trying to anything, the sooner you get anything diagnosed, is a better quality of life, with anything. But definitely a child, because can you imagine them going through, say like the child was like in the third grade and it never got diagnosed. And then they went from third grade to like all the way to like eighth grade and not remembering things and falling behind like in the classroom. I would say it's very important to try to, identify the signs, especially if you see it and you may brush it off like, like, oh, well, they're just daydreaming, or oh, they're just this. Just kind of like pay attention to it if you can, and don't be afraid to like discuss things with your physician. Like, hey, I noticed XYZ. Don't be afraid to do that, because you may catch something earlier, and then that your student or your child will have like, be able to progress better as they, go up those milestones.
Thank you for that. I
Yeah,
want to make sure we dive into data. What's the percentage of people that are diagnosed with epilepsy? Is there a general guess as to how many people have epilepsy
yes.
and have not been treated? Can you walk me through kind of the statistics?
So I have some statistics for you. So one of the ones that I when I am doing outreach for epilepsy, because that's what I do. I'm the community resource specialist, and I really love doing that. 1 in 26 people have epilepsy, and that's about 4% of the population.
Really?
Yes. And so I know whenever I say these numbers, because even for me, I'm going to be rarely honest with you. When I like saw these numbers, I even was like, what? Because epilepsy is not talked about a lot,
I know.
and I feel like, yes, my stepdad had epilepsy, but I haven't met a lot of people outside of that until, of course, I started working with Epilepsy Alliance, that have epilepsy, because there's such a stigma around it. 3 million people in the US actually have epilepsy. It can occur at any age, although 50% of the patients are diagnosed around age 10. But like I said, my stepdad didn't start having seizures until he was like in his 30s. So it can happen at any point in life. Every 4 minutes, someone has a seizure. Right here in Florida, right here in our Sunshine State, 500,000 people are living with epilepsy. 90,000 of those are children.
So 500,000 of, you said
Floridians.
3 million in the United States.
Yes,
So we have 1/6 of the epilepsy population.
we do. We do.
What?
It's more common than MS, is more common than cerebral palsy, and it's more common than autism all combined. So that's how common it is. But, you never really hear people talking about it. When I've talked to clients, I understand, because I talk to clients sometimes. Met a young lady one time, she had epilepsy, and she had a conversation with me, and she said, you know what? I'm seeing this guy, and I'm scared to tell him that I have epilepsy, because I'm afraid he doesn't want to deal with it. I'm afraid he's going to like, say, I can't handle this and I can't talk to you. So, it's a stigma, because if you ever seen someone have a seizure, it can be a very pretty kind of like scary ordeal. So, just trying to break that stigma is just very important, because that is, yes, 1 in 26 people have epilepsy.
How does Florida have such a lopsided number of individuals diagnosed versus across the rest of the country?
So I'm going to say here in Florida, so when we talk about things that trigger seizures or what triggers things that are happening that can make it like where, okay, this person may need to get diagnosed, or they may need to get seen. So in Florida, one of the main triggers of a seizure is the heat. So because we're in Florida, because we're in the Sunshine State, can have heat strokes, and then people can have like a seizure based on, the temperature. So that's one of the reasons why I think Florida is, up there in numbers. But, there's other triggers too, like brain injury, like, people not wearing helmets when they ride bicycles or motorcycles, and then, they bump their head and they can have a seizure because of that. Medication, not taking your medication, that's also a trigger. Like you said, flashing lights, that's also a trigger. And one of the triggers that people don't think about, have you ever seen like you're driving down like a country road and there's like lots of trees. And then as you're driving, it's like trees, sun, trees, sun, trees,
Yes.
sun. And that can also be a trigger as well. So, all of these things can cause someone to have a seizure.
Okay. This is something to digest a little bit. So
Yes.
if I'm just using common sense,
Mm-hmm.
if the heat is a trigger, and that's why we have 1/6 of the total number, then essentially somebody that's in a cold state, Montana, North Dakota, etc., that might not have access to heat may not have an idea that they have epilepsy because they aren't triggered, the seizures aren't triggered by the heat. Is that
Right.
fair?
That may be safe to say, but I'm just gonna say the heat is just something that stands out for Florida because we're here and the temperatures can like really be scorching in the summer. Now in a colder state, there could be many other triggers that are unique to that state as well. So there's many different triggers for someone to have a seizure.
Even, I mean, we could talk about this for days, and
Yes.
I don't think my jaw is going to come up. I have a hard time. It's like it's hard to really conceptualize that there's 3 million epilepsy cases in the United States,
Mhm.
and 500,000 of those are in this state, and there's
Yes.
49 other states.
Yes.
That's super interesting. Hey, maybe that's just something we need to continue reading on or something like that.
Yes.
It really brings me to my next question, which is this something you're born with, or is this something that can happen over time? Because you were talking about the helmets earlier, and I was thinking about traumatic brain injuries. Is that a leeway into potentially being diagnosed, or is this something that you have to deal with at birth?
So that's a very good question. And that's a very common question that I get a lot. So epilepsy is not hereditary, but it is genetic. And it means it's based on your individual makeup. So, whatever makes you, you, whatever makes Randall, Randall, whatever makes ya, 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 that can determine if we're going to have epilepsy or not.
Okay, so it could be imprinted, like your
Yes.
parents. They have generations. At some point, somebody may have had it residing in their DNA, got passed down, got passed down, got passed down, and then boom.
Yes. But
Okay.
it's not necessarily like hereditary, like I said. So say just because my mom or my dad or my grandmother had epilepsy, that doesn't mean that I will develop epilepsy because it's not hereditary. So it's not something that can get passed down. It's it's based on your individual DNA, your individual genetics, your individual makeup.
Okay. That
Yes.
makes sense. All right. Thank you for that.
No problem.
Let's talk about the Alliance. Obviously, you and I have just discussed Florida specifically. My goodness. We have so many people who are dealing with this disease, and we have so many people that we want to reach our hands out to and let them know it's going to be okay, and we want to help them.
Yes.
And obviously, that's why you guys exist. I know that there's a couple of epilepsy foundations across the United States, and we have a couple here in Florida as well. But specifically, the Epilepsy Alliance, you guys, I know for a fact are statewide. I don't know if you're national, but can you just give us a little synopsis about the foundation, the nonprofit, and what you guys are aiming to do?
Yes, I will be happy to do that. So, our mission here at Epilepsy Alliance is to make sure we are providing unwavering support to those impacted by epilepsy by kind of confronting the spectrum and the challenges that are created by having seizures. So, that's our mission. And I'm very happy to be a part of that. And along with that, we provide educational presentations. That's one of my favorite things to do is to educate and empower people on, epilepsy and how we can support the community and how we can further those conversations around stigma. I provide seizure first aid training, which is another thing I love to do because I love to prepare someone just in case they ever come in contact with someone having a seizure. They'll have the tools and they'll have the first aid knowledge and know how to respond. Because when someone has a seizure, it can last, 1 to 5 minutes. So we all know, like, yeah, even if we call 911, we still have to be there with that person until, paramedics arrive. Being equipping yourself with that knowledge and learning how to respond to a seizure is it's one of the best things that you can do for yourself, because you never know. You never know when someone's going to have a seizure. We also provide support groups, individualized case management. We have medical services, medical assistance. We even have a camp for the kiddos called Camp Boggy, and we have counseling, and so much more. So that's a little bit about our organization and how we support the epilepsy community.
Okay. Let's unpack a little bit of it. First aid. What is different about first aid with seizures than typical first aid? If you see somebody and you're talking about chest compressions, mouth to mouth, and these other various things that we have more knowledge about. What's the difference between standard first aid and then seizure first aid?
Okay. So in CPR, we all know that it's going to be immediate, because when the person stops breathing, we're trying to get them to breathe again. We're trying to administer that first aid so they can at least, start breathing again. So seizure first aid. So in CPR, the care that we're giving is immediate, is hands-on there. Seizure first aid is a little different, because when someone has a seizure, you're not going to stop someone from having a seizure. They have to have the seizure. So your first aid comes in, supporting the person while they're having the seizure. You're doing things like making sure you're turning them on their side, just in case they're vomiting or saliva comes out, so they won't, choke on that. So you're making sure you're removing like objects out of the way, just in case like they're wandering around or they're falling, you can like, hey, let them gently fall to the ground if that's the type of seizure they're having. You're putting soft things under their head. So, when someone's having like the tonic clonic seizure, the generalized seizure, when their head is going back, you want to make sure you're supporting their head. And you want to make sure that you're staying calm through the whole process, and you're with the person and you're timing it, because your job is going to be when the paramedics arrive, if the paramedics arrive, you're going to be the one relaying all the information, right? Because the person that's having a seizure, sometimes when they come out of a seizure, they're confused. They may be dizzy. They may not be feeling well, and they may not even remember. Like I said, I just witnessed a seizure, like a week ago, and the individual that had it, they didn't even know they had a seizure. So it's very important when you're doing the seizure first aid, like, hey, you're gathering all these facts, you're timing it, because, when you are relaying this information, you're really helping the person kind of access, like, what's going on with their seizure.
Okay. At any point, do you try to brace them? Like if they're shaking or being violent in their convulsions, are you trying to like wrap them up, or are you just paying attention to their head and neck area and making sure that, they don't hit their head on something and or give themselves whiplash, et cetera, et cetera?
This is another important question. So we never, ever, ever want to restrain anyone having a seizure, because we don't want to cause any harm to them, and you don't want to cause any harm to yourself. So when someone is having muscle spasms and convulsions, they are not in control of their body at the moment. So if you're trying to restrain them, we don't want any injury to come to the individual, and definitely we don't want any injury to come to whoever is providing the seizure first aid.
Okay. So
do not restrain it. No.
At all. Okay. So no, don't hug them.
No.
But how would you suggest, what's the best mode of action for protecting their head? Do you put your hand behind their head and just like try to catch it?
Yes.
Okay.
So I'm gonna give you an acronym that we use when doing seizure first aid. It's called TRUST.
Okay. It's a good one.
The first T stands for you turn the person on their side gently. So if someone has falling down, you're going to gently like turn them on their side, like I said. So just in case they have like any fluids, it can like drain out the side of their mouth. The second thing you want to do is remove any hard or sharp objects. And that could be like, even if they're wearing glasses, you want to make sure that you take the glasses off so like they don't break, and then, they won't get cut on their face. Or if a person happened to be wearing something like a tie or a choker, you kind of like want to remove that too, so it won't cause them to like, choke or like, restrain their neck. Then you want to use something soft under their head. That's the U. And that could be like, say you have your hat on. If you had like another shirt or hoodie or a jacket, you want to take that off, bunch it up, and you can put it under their head. So anything that's around. But yes, if you don't have anything around, like, if it's safe and you can do it in a way, like, yes, putting your hand under their head. Yes. Uh, then the S is going to stand for stay calm and stay with the person. And so make sure that, if there's other people around, that you're making sure like, hey, you call 911, and hey, like everyone back up and give them space, like, hey, make sure. This is a big one for me. In the world that we live in today, everyone wants to record everything. Make sure you're giving the person dignity, right? That's one of the reasons there's a stigma around epilepsy. So make sure like you're not recording this person having a seizure just so you can put it, on social media. It's very important. And then the last one is time the seizure. You want to time the seizure because usually a seizure is supposed to last anywhere from 1 to 5 minutes. So if you find that the seizure is lasting like after 5 minutes, like you want to be able to tell the paramedics, because that is considered a medical emergency if it's lasting more than that.
Okay. That's easy. Trust is easy.
Trust is easy.
I'll make sure that's in the show notes, and when we post out, I'll make sure that's a part of it. I'll include some statistics as well.
Great.
This has been fantastic. I have a couple more questions if you don't mind.
I don't mind at all.
Wonderful. So I'm going to give you a scenario. So a parent sees that their kid is breaking concentration. They're dealing with focal seizures. They go to a neurologist. They get diagnosed. They do, in fact, have epilepsy.
Mm-hmm.
At what stage, could be the very first stage, after leaving that appointment, do they say, I need to call the Epilepsy Alliance?
Great. So anytime after that step, they can call Epilepsy Alliance, because after this step, once someone gets diagnosed, then they can become a client of ours right away. And so they will have all of these resources for free. All of our resources are for free. They'll have all of these resources at their disposal to kind of navigate and help them and give them the extra support that they need.
Okay. And then I know you ran through a lot of what Epilepsy Alliance does, but kind of to reiterate, assume, they come to you, they become a client, and they have all these resources for free. What do you see as the common resource that's provided to somebody that comes to you? What's the most used resource? I mean, what are some of the things that you see more oftentimes than not?
So the most popular services that I see getting used is definitely the individualized case management, because when someone first finds out they have epilepsy, because it's not talked about a lot, the case manager can give them the individualized attention that they need and help them navigate programs and navigate the things in their area. And that could be anything from helping them either like with medical insurance. It can be helping them, with medicine trials, just different things like that are kind of unique to that person.
And how
also, the seizure first aid. Oh, I'm so sorry.
No, I'm sorry. I didn't realize you had so many other things.
Yeah, and I'm going to say the seizure first aid and the support groups too, because like when you become a part of a support group, then you get to connect with other people that are living that same experience, and also the seizure first aid training, because whenever you become diagnosed, like for the example that you gave me, then, hey, we can go out to the schools, we can go out to your job, if you have a gym or belong to a church or anything like that, and train people what to do, so you can always have someone that's there that can help you if you have a seizure.
How important is community in this scenario? I mean, people who are dealing with epilepsy, we're talking about stigma. Maybe a lot of these people feel alone. You gave an example of somebody that didn't even want to tell their partner that they had it. So, finding out that other people are dealing with things that are similar to what they're dealing with, in your experience, how important has that been to the individual?
So in my experience, when someone has a community, it makes you feel automatically like you're not alone. because I know a lot of times, whether you have epilepsy or not, sometimes we always think that our situation is unique and nobody understands what we're going through. So when you're able to be a part of a community, be a part of something bigger than yourself, or be a part of something, a community that can relate specifically to what you are going through, that's invaluable. A community is huge, and having a community also starts to allow those conversations to happen, allow those ecosystems to happen, like, the safety to happen around, epilepsy.
Okay. And how is EA funded? Are you guys just full of donors, or are you getting funding from the state, from the federal government? How does that look?
I think it's all of the above. So we definitely get state funding. We also have donors, and we run off of donations. So if we're always taking donations, I have information on that. Yeah. So those are many of the ways that we get funded.
Okay. And if somebody wanted to get involved, where could they go? If somebody wanted to donate their time and or their money?
Great. They could donate at epilepsyallianceflorida.org. We also have Carpe Diem, and you can find that also at epilepsyalliance.org, or you can call our number 877-553-7453.
Okay.
And
Wonderful.
we also have an event coming up if anyone wants to get involved. We have a walk at the zoo. It's this Saturday, March 29th. And so at the walk, you can register, you can donate. It's going to be from 8 to 10. We're going to have DJs, prizes. It's going to be so much fun. The zoo opens up at 10. If you come to our event from 8 to 10, you get to stay at the zoo already. You're already in there for as long as you want. So it's going to be a fun time.
How does somebody show up to the event? Do they have to donate to a team, to a cause? Do they show up and just say that, hey, they're here to support? I'm sure that myself included, we're going to want to show up to this thing. So what does that look like?
So it looks like I have flyers, but you can go to walkthetalkfl.org, and there you can register if you want to be a team. We love to see teams. So I encourage you, if you have a group of people, to start your own team. But if you're a team of 1, 2, you would just register. You can donate anything that you're able to donate. Register your name. And so when you come down to the zoo, we'll have a registration table and you come right on through.
Okay. Do you have a team?
I have a team of my coworkers, yes, but because I'm the community resource, I will have like my table set up to give you guys all the resources. So anybody, that wants more education around it, or anyone that wants, more support and resources, I'll be having a table there. So I will see anybody there can come visit my table.
Okay, wonderful. Before we go, did I miss anything? I know we talked a lot about epilepsy. I know we talked a little bit about the foundation. I may not have covered it all. Was there anything that was important about either thing that we should be bringing to the table?
We covered a lot. I just wanted to say, I don't think we brought this up, but like, epilepsy is not contagious. So I know that was like some outdated myths that used to go. And I always like to do that. Also, some other things that I didn't think got brought up. Sometimes people think that they have to stick something in someone's mouth when they're having a seizure. So please don't do that, especially your finger, because if you stick your finger in someone's mouth when they're having a seizure, can you imagine, like, you will definitely get injured. And we don't want to stick like a wooden spoon, a leather belt, a leather wallet, because believe it or not, I get asked these questions. So that's why it's so important to have these conversations of these outdated standards, that you are not doing that because you don't want to cause any injury inside the person's mouth. So I think those are some things that got missed, but yes.
I'm glad you brought them up, because I would have never thought to ask those questions.
Yes.
And because it's so important, and if people are asking these questions, I'm glad they are, really, truly.
Yes.
I want them to get the answers. But if these questions are pervasive, then maybe what we should do is work out something where you come on periodically here and we continue to have this conversation and continue to push out various levels of content so that we can make people more aware of what to do, what not to do, what to look out for, what not to look out for.
Yes, I would be happy to do that. Yes, I would definitely be happy to have those conversations.
Awesome.
Keep the conversation going.
Yes, we'll keep it flowing. Couple of things. Best of luck on the PhD.
Thank you so much.
I'm very excited to root from afar and see you succeed. That's going to be fantastic.
Thank you.
I started this podcast to meet with pioneers and builders, but that included entrepreneurs and small businesses and city leaders and influential people. But a big one for me was nonprofits. I wanted to see all the good work that was going on in our great city. It really put a spotlight on it, especially if more people weren't aware. And so from Jacksonville, I speak for everybody when I say thank you and thank the Alliance for all the great work you're doing. Please keep it up. I will see you Saturday. And from the bottom of my heart, thank you for being on PB and Jax.
Thank you. And I just want to say, Randall, thank you so much because it's so important that you are doing this work. Let me just say that it's so important. I think we talked about this before, that you are involved in nonprofits and that you are highlighting some of the amazing work that these organizations are doing in our area, because sometimes they get overlooked and sometimes they're not, shared. I know Jacksonville is kind of like, one of those things, like it's really big and you have like the South Side and you have like the North Side, you have like the West Side, but thank you so much for, shining light on, community work. We really need more people like you out there doing that. So thank you so much. And thank you so much for having me.
Well, thank you so much. That means a lot to me. Speaking of different people doing great work, obviously the Epilepsy Alliance, that's what this episode was meant for. When this episode comes out on the 31st, it'll be Kaya's birthday, my niece. And so I want to say happy birthday to Kaya. And then the two logos I'm wearing, Wounded Warrior Project, doing amazing work with wounded veterans. I will always support the work they're doing. And then the Think Bold conference on April 12th. Troy McNair and Mo Henderson put on this is year 3 of a wonderful conference where they bring so many people in Jacksonville that are doing amazing things into one room, which happens to be at the Hyatt, and it's going to be the biggest one yet. So to give people the spotlight they deserve, whether it's through podcasting or the festival, I'm all for it. So this is just the early stages of something I think is going to be substantially bigger.
Thank you so much. And happy birthday to your niece, Kaya, too, as well. Happy early birthday.
Thanks, yeah. All right. Well, until next time, thank you for being on, and we'll chat very soon.
Thank you so much. Have a great day. Thank you.
You too.